All right, welcome back. It is Free Therapy Wednesday, and this week we're going to put the spotlight on a very serious and very important topic.
Yeah, this week is National Suicide Prevention Week. And understanding the warning signs, knowing the risk factors, and having access to the right resources truly can save lives. It's been a big issue among our young people. Joining us now to talk more about it is Hartford Healthcare Institute of Living psychologist, Dr. Laura Saunders. Hi, Dr. Laura.
Hello, friends. Happy Wednesday. And yes, we're talking about a pretty serious topic today. It is National Suicide Prevention Week, but this is such an important topic to talk about because stigma is often what causes people to not bring up their depression or not bring up their suicidal thoughts. We need to talk about this openly.
Do we say epidemic since it is the second leading cause of death in ages 10 to 34 in 2023?
So it is, I mean, it's something that's largely preventable. It is an epidemic. And, that's why we need to help people understand what the risk factors are, understand what the resources are, and really just allow more openness. And that could be openness between friends or openness between a parent and a child or an adult child. We need to talk about this more openly.
Okay, and when we know the risk factors, we can do something. But one thing you want to get out there, sometimes people think, I don't want to mention this to my loved one, my son, my daughter, that are you thinking of killing yourself? Because that somehow you're going to give them that idea. In fact, that's just not true. And we should be asking those questions or looking for signs that they're thinking of that.
So you're brought up a good point because that is a myth. It is a myth that if I ask them the question, are you having thoughts of ending your life or killing yourself, that I'm putting the idea in their head. If you're noticing some of the risk factors and warning signs, the idea is already in their head. You're now opening the door so that they can say, yes, that I've had these thoughts. I didn't know what to do about them. So you're not putting the idea in their head. You're opening the door to greater conversation.
Could we go over this statistic? White males accounted for 68% of suicide deaths in 2023, while females are more likely to attempt suicide, meaning they don't succeed?
Yes. So what we know is that males tend to use more lethal means, like gunshots, like hanging. They use more lethal means, so they're more likely to die by suicide, whereas females use what we'd consider less lethal means. And so therefore it becomes an attempt, but still very, very serious and a need for help.
What are some of the biggest risk factors we need to know about?
One of the biggest and most predictable risk factors is if someone has tried had thoughts or tried to end their life previously. Substance use is a huge risk factor because that dramatically increases risk by intensifying feelings of hopelessness and impairing judgment. It's a myth that, this comes out of the blue because almost always there are significant mental health issues or significant life stressors that are impacting someone. And so those are two very big risk factors as well.
The survivors of people who have gone the way of suicide, the guilt and how do you deal with that, Doc? How do you help those people?
So it is immense. It is absolutely immense because so often family members or friends feel that they should have done something, they should have said something, they should have intervened. So it leaves people with a lot of really strong and really painful grief. And so that's why it's never just an individual ending their life. There's a trickle effect that happens that affects so many people. So if this is something that's preventable, we need to talk more openly about it. And we really need to reach out to those people who we think are struggling, ask them a question. I don't want a lay person to evaluate someone, but you can say to your loved one, I've seen you really withdrawing. You've been very isolative. You seem very depressed. Are you having thoughts of ending your life, or are you having thoughts of suicide? And if they say yes, it's then getting them to the resources.
So there is a suicide and crisis lifeline that it's sort of like 911, only you want people to know it's 988, and that's what you would call if you really think someone is going to be trying to end their life. You can get in touch with experts easily by dialing 988.
988 is for suicide and and mental health crises. The other one I'd like to highlight, because we're in such an era of texting, is 741-741. It's, right in line on the keypad, and you text home, and then you'll reach a live trained volunteer if you're more comfortable texting. Or the Trevor Project has all sorts of information and resources for LGBTQ individuals, both youth and adults, but either 988 or 741-741.
To text, okay.
All right. Well, we appreciate you bringing this very serious topic to our attention, Doc. It's always good to see you.
Have a great day.
All right, you too.
Thanks, Dr. Saunders.
All right.